I wanted to start today's video with a message that I received from a concerned mom. She says, the doctor says to put the baby to sleep on her back. She keeps rolling over to her tummy and I'm up all night long rolling her back to her back. I want to keep her safe and I'm terrified to let her sleep on her stomach. Can you help? Yes, I can. The first thing that I want to say is take a deep breath. Relax. It is okay, and I promise you, your baby is safe. First things first, remember that I am not a pediatrician. This is not medical advice. I am a certified pediatric sleep consultant, and my advice comes from my sleep consultant certification training. If you need medical advice, then I 110% recommend that you go speak to your child's pediatrician. So as long as you're doing your part by putting your baby in a safe sleep environment and putting them to sleep on their back, then you've done your job. Your baby is safe. If you put your baby down to sleep on their back and they happen to roll over onto their stomach, the first thing you want to do is make sure that they are not swaddled. Now, as soon as you started noticing that your child was learning how to roll, you should have transitioned them out of a swaddle and into a sleep sack. If you did not, then I retract my previous statement. Your baby is not safe and you do need to stop swaddling. Now, I'm not trying to impose fear on you or anything, but the reason behind needing to stop swaddling once your baby starts rolling is because if you're swaddling with their arms up, okay, just for example, and they roll over and they're too tight and their face is up against a mattress, their hands are not free to push themselves up. And then the same thing happens if you're swaddling them with their arms down. Where are they going? I mean, maybe they can move their neck around, but they can't roll back. So you have to stop swaddling as soon as you notice that your baby has started to roll over. Get a sleep sack. You can get a zippity zip. You can get a transitional swaddle. Anything where your baby's hands are free and they are able to push themselves up and roll back over, or at least be able to push themselves back up and call for help. Now, of course, your child's call for help is not going to sound like, help ma, I'm rolling over and I can't get back. It's not gonna sound like that. It's gonna sound like a distressed cry. And as long as your child is in a sleep sack and they're not swaddled, what you can do is wait and watch. I know it can be hard to hear your child stressed out and not knowing what to do or how to help them, but if you wait and watch for just a few moments or a couple minutes, if you're okay with giving them a little bit of space to see if they roll themselves back, then you can give them the opportunity to do so. Now, I'm hoping that since your baby was born, you've been practicing tummy time, so your child is used to being on their stomach and they do have the neck muscles to push themselves up and to rotate their neck around so that their face is not pushed on the mattress and that they can get fresh air and breathe. So if you give them this opportunity and you just wait and watch, also known as the magic pause, check out this video next for more details on how to do the magic pause. But if you give them that minute to fall back asleep, they're either going to find themselves a comfortable position on their stomach, or you will do step two. Step two is to gently roll your baby back to their back. If you do need to roll your baby back over so that they can get back to sleep, I do not want you to pick your baby up and take them out of the crib or the bassinet at this time. If it's a time for a feeding or if they need a change of diaper, then obviously do what you need to do to meet your child's needs. But if it's not time for a feeding or a diaper change, then I want you to just roll them back, keep a hand on your baby for a moment and help soothe them back to sleep. Chances are your baby is only a couple months old, so do we think that they're gonna self-soothe? No. Do I expect them to self-soothe? No. Can you practice getting them back to sleep with a little shush pat action? Of course. The moral of the story with just rolling them over and leaving them in the crib is that you don't want to overstimulate your child, and something as simple as picking them up and pulling them out of bed and bringing them close to you is going to kind of start having your child have the expectations that that's exactly what you're gonna do and you're gonna put them straight back to sleep. Now, that's not a terrible thing, and especially at this age, we know that your child is going to need help getting back to sleep. However, if you try to get them back to sleep first with just your hand on them, maybe rock them side to side, maybe give them a little pat and a little shushing like we talked about, then hopefully they can learn to fall back asleep with that minimal amount of help. Now, if things escalate and your baby's crying, we don't want babies crying at this age, so go ahead and pick your child up. The purpose is to just Help your child at first and see if you can get them back to sleep with the least amount of assistance possible. Practice makes progress, but sometimes it doesn't work and you're going to have to pick them up and assist them back to sleep however you need to do. That's something you can worry about down the road. But for now, help your child as needed. The third thing you should do when your baby starts reaching this milestone of rolling one way and not the other is that you could practice during the day. Just practice rolling, rolling, rolling. Isn't that like a Walmart song? Keep those prices rolling, 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 roll back. Or, okay, no. Practice having your baby roll during the day like a little Tootsie Roll. Tootsie Roll. At least I entertain myself, okay? The process in which your baby is rolling one way and not the other can take up to a few weeks, might take a month, and it will feel exhausting, but you will find your groove and you will start drinking coffee if you were not a coffee drinker before. I actually never ever drank any form of caffeine until I had my third kid, and at that point I was like really freaking exhausted, not because my kids didn't sleep. Of course my kids slept, I'm a sleep consultant, but because having 3 kids under 3 was very exhausting. The last thing that I wanted to mention is to make sure that you have a lot of patience through this process. I know you're exhausted, I know that you're tired, and I know you're ready to get your sleep back on track, and you will get there, I promise. Just remember the ABCs of sleep. Put your baby to sleep alone, on their back, and in the crib or bassinet, whatever you're using at this point in your child's life. But just make sure that they are in a safe sleep environment and that you are following what the American Academy of Pediatrics recommends as far as safe sleep, and always following the Back to Sleep campaign, putting your baby to sleep on their back, and if they roll over on their own, then they are fine. Within a couple weeks of learning this skill of rolling over, you are probably going to notice that when you put your baby on their belly for tummy time when they're awake, you're probably gonna look away for 20 seconds and you're gonna look back and they're going to have rolled themselves to the other side of the room. So make sure that you baby-proof everything. Remember to enjoy the little moments and that this phase passes so quickly. I wish so badly that I could go back in time and just like be a part of what you're going through right now, because when your kids get older and they're out in the world doing things, it's a whole new world and it's a whole new realm of motherhood. Enjoy the chapter that you are in right now. I know you're tired, I know you are, but you will get your sleep back and I'll be here to help you every step of the way. Don't forget to watch the magic pause video after you finish this video and keep blooming. Mwah!